Hi, welcome to Proven Cures. I'm your host, Sarah McLeod. Today is Saturday, October 26, 2024. And today's video is actually going to be about clinical practice guidelines for at-home oxygen use for persons with COPD, chronic obstructive pulmonary disease, and ILD, interstitial lung disease. And this is a first for this channel. I never share clinical practice guidelines. And the reason for that is because clinical practice guidelines, as the name implies, are guidelines typically for clinicians. They're to be used for the betterment of the patient, but by a professional. It is only in my years, the past 5 years as a medical writer, that I've discovered that clinical practice guidelines are not only useful for clinicians, because a lot of times clinical practice for certain patients with chronic diseases has to be transferred to at-home care. And so a lot of those guidelines are applicable to at-home therapy, only that treatment has to be either offered by a home health professional or education is given to the primary caregiver of the patient. So with persons on at-home oxygen, chronic disease such as COPD and ILD, oxygen is normally required for 15 hours out of the day. So these practice guidelines that I'm going to share are in fact applicable to persons who do care for these kinds of patients. Now, what struck me, let me tell you how I came with this idea in the first place, guys. Because normally, my only interest in television, okay, is informational stuff. That's just the kind of personality that I have. I'm a nerd, obviously, because of this channel. But the persons I live with like for a lot of frivolity, so I get caught up in the crosshairs, you know. So there's this talk show in particular that gets played a lot in my home, and I've come to enjoy it because the person who delivers the show is a licensed psychotherapist. So he's able to actually analyze the individuals on his show to kind of get to the source of their behavior issues, not just as an individual, but within whatever group dynamic they come to on the show, be it with family, be it in marriages or what have you. So it's very interesting, especially to me, because I don't have any behavioral therapy training. It's very interesting. And then on this one particular show, guys, there was this family consisting of the mom, and I think she had like 4 or 5 daughters, and her husband, their dad, passed away, and they come on the show blaming each other for his having passed away. He was at home on oxygen therapy, and by how they were explaining it, the day that he passed away, earlier that day, he'd been in respiratory distress. He was hyperventilating, he had shallow breaths, and no one thought to give him his oxygen. So the mom was vehemently blaming her daughters for not having taken care of him. And one of the daughters turned, the daughter that was there with him all day, that hadn't given it to him, stepped out because she had her own children to take care of. And then I guess she got tired of her mom blaming her. So she turned to her mom and was like, well, you were there part of the day. You could have given it to him. And it was a catastrophe, and it was very sad because this mishap is causing a further split in the family. So now not only have they lost the man of the home, they're losing each other. They're losing the love from each other that they need to grieve properly and to move on from his death. It was very sad. I didn't even see the psychotherapist was able to mend the relationship because the mom walked off the stage in anger That being said, you could look at it and say, well, Sarah, why would you, go as far as to look up clinical practice guidelines in this situation? Well, check this out, guys. If you go to buy a car, right, as a regular consumer, you're going to be looking at how the car looks. You're going to be thinking about how previous models, how the longevity of previous models, what your family and friends might think about this car purchase. But if a mechanic goes and buys a car, the mechanic is looking at how much do the car parts cost? They're going to look at serious intricacies of a vehicle that those of us who don't work on cars won't even consider normally. And that's the kind of way I was kind of looking at the situation, because I'm like, they come on here, they're telling us the clinical symptoms that their dad was giving. They were negligent. I'm not going to say they weren't, but it wasn't willful negligence, because they all love him. They all loved him. They were all in tears. So where, in fact, was the disconnect between identifying the symptoms and knowing when to give him the oxygen? That is where clinical practice guidelines come into play. And that is why I chose to share them here on this channel. So the title of the and let me tell you. So it goes even further for me. The rabbit hole got even deeper, because what shocked me in my research was that clinical practice guidelines for these specific populations that require 15 hours of oxygen therapy per day at home they didn't even come into being until 2019. And they were not published until 2020. And now it's 2024. We have persons at home with COPD for years and years and years, and nobody has published a practice guideline for their caregivers. I was floored. Listen, all of us who are over the age of 30 know that this modern ideology of cigarette smoking being gross, being unhealthy, we don't smoke indoors anymore, smokers are ostracized, the knowledge of secondhand cancer and all of this is fairly new information of the past 30 years. Prior to that, smoking was cool. Smoking was the norm in a lot of homes. I remember being a little kid going to the corner store to get my dad's cigarettes. That's how normal it was back in the day. And now, everybody, now I'm going to say everybody, but a vast majority of these smokers, these pack-a-day smokers, 20 and 30-year smokers, if they didn't contract cancer, they did in fact contract lung disease that had them at home on oxygen. And only until 4 years ago do we get an actual published guideline on treatment, and only until 4 years ago do we have something saying, hey, we need in-home educators to show people how to take care of their family and so on. So this to me, this is critical, and this also gives you, even if this particular if your loved one doesn't have COPD, doesn't have ILD, no matter what the issue may be, this gives you a way to look for more information for yourself, to know that you can go online and do a deep dive, type in the name of the disease, type in guidelines, see what comes up. See if you are indeed doing the most you can for your loved one. And if not, take this guideline to your physician and let them read it and see what they have to say. Maybe the most is being done, but maybe the most isn't being done. So let's dive in. So the title of the document is Home Oxygen Therapy for Adults with Chronic Lung Disease, an official American Thoracic Society clinical practice guideline. I'm looking that way, guys, because my computer's over here. I've been trying to do these videos on my computer. The videos come back blurry, grainy. They're not so good. I'm trying my best with what I have. I think over time I'll get into the whole having the big boom mic and all this that I see the fancy channels do, but this is what I have for right now, okay? This is the official practice guideline of the American Thoracic Society. It was approved, pardon me, September September of 2020. And it was published November 15th of 2020 in the American Journal of Respiratory and Critical Care Medicine. So let's have a look at some background information. This shouldn't take too long because I'm just gonna share a summary of the recommendations with you guys. Okay, I'm not going to do deep dives into all of the clinical trials that they looked at to come to their decision making. I think there were 13 clinical trials. There's no need for all of that because what's important is why they had to come together, why these professionals came together, and who these professionals are, because they're not just bringing a consensus on the clinical trials that they reviewed. They're also bringing a consensus recommendation based on their day-to-day workplace activities, what they see taking place with patients, what they know to be critically needed in the field based on whomever it is that they treat. So 5 million adults live with chronic lung disease in the United States, 5 million, with more than 1 million prescribed long-term oxygen therapy, defined as oxygen prescribed for at least 15 hours per day. The rationale for the provision of long-term oxygen therapy in adults is based on the survival benefit reported by 2 randomized clinical trials published over 3 decades ago in patients with COPD and severe chronic hypoxemia. Chronic hypoxemia meaning low oxygen saturation in the blood. Since then, an additional clinical trial has examined the role of home oxygen therapy in patients with COPD and moderate resting hypoxemia or exertion-only hypoxemia, called the long-term oxygen therapy trial. Although several professional societies and groups have published clinical practice guidelines for home oxygen therapy, most have not incorporated the recent results. Recent data highlights significant differences in home oxygen needs and experiences across patients with different lung diseases, lifestyles, and oxygen supply requirements. For example, the physiologic mechanisms of hypoxemia differ between obstructive and restrictive lung diseases. The rapid and steep rate of exertional desaturation for patients with interstitial lung disease differs from that of those with chronic obstructive pulmonary disease. These considerations highlight the need for guidelines specific to individuals with COPD and ILD, which is short for interstitial lung disease. These are the 2 major diagnosis entities for which oxygen therapy is prescribed. All right, so let's get a look at the guideline panel. So the guideline panel consisted of 4 co-chairs and 18 voting members, of whom 11 were pulmonary and or critical care physicians, 4 nurses, 1 registered respiratory therapist, and 1 physiotherapist. To grade the information, that the quality of evidence they found, they used the grading of recommendations, assessment, development, and evaluation approach, also referred to as GRADE. They adopted a published terminology for home oxygen therapy, which is available if you want to look this up yourself. I'm going to, of course, include the information in the discussion section. You can always find it. It's easily located online. It's public information, and if you want to look up any of this information that I'm sharing here today, including the grade approach, they have supplemental tables with that information. The published terminology for home oxygen therapy, there's a separate table for that as well. Okay, so for the systematic review to June of 2019, the panel defined severe hypoxemia as having peripheral blood oxygenation at equal to or less than 88% as assessed by pulse oximetry, or having a partial pressure of oxygen at equal to or less than 55 as assessed by blood gas sampling. The panel defined moderate hypoxemia as having a peripheral blood saturation at 88 to 93%, or partial pressure of oxygen at 56 to 60. Again, they define severe exertional hypoxemia as having peripheral blood saturation at equal to or less than 88% on exertion. They found substantial variability in definitions for severe hypoxemia across studies, and the data were not reported in a way that would allow reanalysis of outcomes at different thresholds. All right, now let's dive into it's just a summary of the recommendations. Well, before I even get into the summary of the recommendations, I'm going to dive into education and safety. So it's called the best practice statement, and it says for patients prescribed home oxygen therapy, the American Thoracic Society recommends that the patient and their caregivers receive instruction and training on the use and maintenance of all oxygen equipment and education on oxygen safety, including smoking cessation, fire prevention, and tripping hazards. So that right there. So if your loved one or whomever comes home on oxygen therapy and you're one of the people who live in the house with that person, or you're there all the time, and you didn't receive this training, it is important for their well-being that you make the effort, carve out some time out of your week, get in contact with some other family member who can help you make the contact with the doctor, and get some training set up. It probably won't take that much time, probably a couple hours, and you can at least learn what to look out for, so you don't have the same horrible finale that family had that I saw on the talk show. So quick summary of the recommendations. Like I said, you can always go and find this document for yourself. But it says that we're going to first touch on chronic obstructive pulmonary disease, COPD. It says that in adults with COPD who have severe chronic resting room air hypoxemia, the prescribing recommendation is long-term oxygen therapy for at least 15 hours per day. And that is a strong recommendation based on moderate quality of evidence. In adults with COPD who have moderate chronic resting room air hypoxemia, with moderate hypoxemia defined as a peripheral blood oxygen rate of 89 to 93%, the panelists suggest not prescribing long-term oxygen therapy for these persons. This is a conditional recommendation based on low quality of evidence. So that, of course, has to be discussed with the patient's care physician, respiratory therapist, whomever. In adults with COPD, the recommendation is for persons who have severe exertional room air hypoxemia. The suggestion is for ambulatory oxygen, which is another conditional recommendation based on moderate quality of evidence. Now moving on to interstitial lung disease for adults with ILD who have severe chronic resting room air hypoxemia. The American Thoracic Society recommends prescribing long-term oxygen therapy for at least 15 hours per day. That is a strong recommendation based on very low quality of evidence. So I'm sure with the evidence not being rated as high, the clinical trials not being rated as high quality, but it's a strong recommendation, that has to be predominantly based upon the clinicians themselves' work practice and what they've seen at work, and with their own patients. For adults with ILD who have severe exertional room air hypoxemia, the suggestion is for prescribing ambulatory oxygen, which is a conditional recommendation. Once again, the evidence was graded as being low quality. Interestingly enough, in patients with chronic lung disease who are mobile outside of the home, meaning they're up and down, they get around pretty well, and require continuous oxygen flow rates of greater than 3 liters per minute during exertion, the suggestion is for prescribing portable liquid oxygen. This is a conditional recommendation based on what they deem to be very low quality evidence. So all of these recommendations have to be, I would say, except for the strong one based on moderate quality evidence, have to be based on a discussion with the prescribing physician. So that's all I have for you. Like I said, I'm sharing the title and publication and everything in the description part of this video, so you can check that out for yourself for your own use. You can download it, whatever. There's even a PDF available, so you can print it off and keep it in the house, whatever you want to do. At the end of this video is going to be my ad for My Sportswear line. The ad only shows, this was pointed out to me recently by someone who watched the video, and they said, I like your designs, but they're all for girls. They're all for women. They're all for women. First of all, I do have looks on my website for men. So if you're interested in just looking to see what's there, by all means, don't feel that I don't design for men. It is hard for me to design for men, especially being that I'm a very hyper feminine woman. But I do have some designs for men, so you can go and check it out. I like to look at my stuff as being predominantly unisex, with gender being so fluid nowadays. Lots of guys have bought my clothes and they wear them and they like them. Likewise, I've had women wear and model pieces that I made for men. So anyway, just check it out. And thanks for watching. Please like, share, subscribe, comment, and give me ideas about things you would like for me to do research for you on. Okay? Thanks for watching. Till next time. Bye-bye.
For time's sake. As time goes by. It's been a long time. Some of the old